Joining me now to talk more about this exciting new program is Mina Wu, Director of Howard Community College's English Language Center. Thanks so much for joining me today.
Thank you for having me.
Mina, how did the idea for this program develop, and what is the need in our community for it?
Actually, the Horizon Foundation approached us with the idea because they saw the changing demographics here in Howard County. According to the last census, 18% of Howard County residents are foreign born and 23% speak a language other than English at home. So knowing this need, they went and talked to healthcare providers and community leaders to ask them what are the barriers for them to access quality healthcare. And the issue of interpretation rose to the top. They learned that the most immigrant families rely on their family members, often their children, to interpret for them in healthcare settings. And it causes problems for a lot of people involved. It should be the healthcare providers who are qualified and trained as interpreters who should interpret in those sensitive healthcare environments.
It sounds like a great program, but how does the training work? How does someone interpret without being a doctor or a nurse?
The healthcare interpreters do not need the intensive medical training like doctors or nurses. However, they do need to know, have knowledge and familiarity with medical terminology that they'll come into contact with. For example, terminology on anatomy and physiology, medical problems, equipment and procedures that they'll be interpreting for and about. In addition, in our program, we also include some of the very important interpreting skills like cross-cultural communication skills, ethical decision-making, and integrated interpreting skills. So combined with the medical knowledge training as well as interpretations training, our students will be very ready and trained to be able to work as a healthcare interpreter.
So where are the students now with their training, and what are the job prospects for students upon completion of the program?
Mm-hmm. So they're about halfway through the in-class training, and in December they will finish that and begin their field work experience where they're going to have actual experience interpreting in a healthcare setting before they complete their program. And according to the last Bureau of Labor and Statistics, they project that the field of interpretation and translating will grow 29% between the years 2014 to 2024, which is one of the fastest growing occupations. And even now, if students were to do a simple search for healthcare interpreting in Maryland, they'll get a slew of lists for available jobs.
In terms of the cost to the student, approximately how much does it cost, the program?
The program consists of 3 courses. We start off with the orientation, where they're introduced to the field of interpreting as well as a extensive language proficiency test, because we want to make sure that they are fluent bilinguals in both languages. After that, they go through a course which is $495, and the course lasts for about 4 months where they do the theory and training, and after that they do the internship and field work, which is another $160, where they're getting real life experience in healthcare setting, practicing their interpreting skills.
Once they go through the program and they make this investment, which is pretty affordable, how much do they make?
The national average for interpreters are $44,000 to $80,000 a year. However, unfortunately, there are not a lot of full-time jobs here in Maryland, but a lot of them work as private contractors or self-employed, and they do hourly, and they get paid about $40 to $70 an hour.
Okay, so it's a good investment for the short period of time and the limited amount that they have to pay.
Yes, we believe it's a very good program for a very big need in the community.
Yes, certainly is. Well, thanks, Mina, for joining me today on the show to talk about the Healthcare Interpreter Certificate.
Thank you so much for having me.